Hello. Thank you for sticking with me. We are about at the halfway mark. The next major topic we're going to be covering is clinical experience. So many admissions officers are looking at clinical experience because it shows a few things. One, it shows that you're able to interact with patients in a professional manner. And two, it shows a dedicated interest to the field. So if you're volunteering for a couple of years, maybe you've worked a clinical job for a while, that's a serious form of commitment to healthcare specifically. When you're invested in a clinical experience, it's not so much that you stand out from the crowd per se. That is a plus, but a lot of people who are applying, especially at like more prestigious programs, essentially everybody has some type of volunteering experience. Um, what you can take from your volunteering experience that will make you stand out are the lessons you have learned and your understanding of how healthcare works. A number of questions in secondary applications regard your clinical experiences, what you've learned from them, and perhaps your experiences with social determinants of health. Maybe you're in a position where you haven't really had negative backlash from social determinants of health. Maybe you're on another side of the spectrum where it seems like the system is trying to crush you, literally. Where regardless of where you are, stepping into a clinic and actually seeing these patients, learning about these patients' stories, will give you a wide breadth of experiences for you to learn from. So going back to the application itself, you have volunteering in a clinical experience or you have working in a clinical setting. I think volunteering is easier to come by. Um, it can be a bit tricky, especially if you don't have a car. Um, Usually, large hospitals near university will offer some type of volunteering program. If that's not the case, check out local clinics. And even if nothing is like mentioned, excuse me, even if nothing is mentioned per se on their website or there's no particular listing, just email them, call them, see if there's a chance that you may just be an exception. And then there's the job portion of the clinical experience. So a lot of these introductory jobs tend to be, it could be a medical assistant, maybe a behavioral technician, CNA, patient transporter, EMT, etc. A lot of those require some type of certification or some type of tuition, between $1,000 to $2,000, so it can be kind of expensive, especially for like EMT or phlebotomy. I'm not aware of free training programs. Maybe in your area that's different. If so, that's a wonderful opportunity. There are some programs and offices that will train you to be a medical assistant or even like a pharmacy technician. So I think Walgreens has a pretty prominent pharmacy technician training program. Um, and those would be great opportunities for you to take advantage of if you have the abilities to, if you have the time and you have the transportation means. Um, Having the job acts more as a standout because it's a deeper investment into healthcare. You will gain even more experiences because you will probably just have more hours. Um, and as a byproduct of that, you will ultimately learn more by being headfirst um, in the field. So to get these clinical experiences, you need to learn how to market yourself. So a couple tips I have listed out here. Don't exaggerate yourself. Try not to come off of sanctimonious or like overly righteous, holy than thou. Just be genuine. Speak plainly and authentically. Writing can be difficult, especially, if you've never written a cover letter before. or you just don't have a lot of experience in writing. So to become a better writer, I would suggest practice writing. And the easiest way to do this is to journal. So write to yourself in some type of journal log about your thoughts, maybe even what you did, any lessons you learned recently, maybe any ideas you're coming up with. Um, Taking different writing classes or humanities classes can help you become a better writer. Um, Creative writing in particular can help you become a better writer. So let's say, maybe try writing some poetry, try writing a short story. Just the best way to become a writer is just to write and then have somebody else take a look at it, give them feedback. Um, one of the one of the most common questions I've seen on secondary applications is give an example of a time that you got harsh feedback or that you were disappointed. Being able to take feedback well is one of the most marketable traits that you can have as an individual. And I think that's about all I want to say for clinical experiences. Just to touch back again, your clinical experiences will be hugely important for writing your secondaries. Borderline 70% of the schools that I remember writing secondaries for had some type of healthcare related question. And while it's not a requirement to be involved in healthcare, actively doing something in some dimension will give you a strong foundation to answer those questions. And while you don't have to answer every question on a secondary perfectly, you do have to answer every question well. And if you don't have any clinical experiences, you won't be able to answer a clinical experience question well. Thank you. Our next topic will be related to broader service.